Welcome to Medicare in Layman's Terms. My name is Travis Dahlman. I'm a licensed Medicare broker. Today's topic of conversation is going to be a little bit different from what we have done previously. There's not going to be any messages popping up, anything like that. It's just going to be myself and my 4 index cards that I created. What's on these index cards are going to be commonly asked questions that I've received on a daily basis over the course of the last 3-4 years working with Medicare beneficiaries, as well as other questions that some of my colleagues have received that have passed along to me that they feel like would be a good opportunity for me to expand to you folks out there. There's only going to be 4 different topics I cover today. Like I said, I'm going to do one Q&A session a month. If I get additional questions out there, then I'll move that up to 2-3 times a month, whatever I need to do. Starting off today, the main question is, what is a Medicare broker? At the start of every video, I say that my name is Travis Dahlman, I'm a Medicare broker, but what does that really mean? What that means is I can sell products for multiple different insurance companies. Previously, I was an internal agent, telesales agent, if you will. So what I did was I sat at a desk for a certain insurance company and I just took internal phone calls. So if you saw a phone number on the TV for this insurance company, or you received an ad in the mail, you called into the phone number on TV or on that ad, you would get rerouted over to my department and I would be able to assist you answering any questions you have about that specific policy or policies in the area that that specific insurance carrier carried. What a broker does is, think of it as you're going into a restaurant. When you go into a restaurant, you have your breakfast, you have your lunch, you have sides, you have dinner, you have desserts, you have your drink menu. When I worked as an internal agent, I could only sell breakfast. I could not sell lunch or any of the rest of that menu. But as a broker, I can sell everything on that menu. That's the best way to describe what a Medicare broker does. As well as, it does not cost anything to use a Medicare broker. Same thing as it does not cost you anything to go into your phone, call an internal agent based upon the phone number that you see on those ads on TV or those ads you're receiving in the mail. So once again, a Medicare broker, such as myself, licensed with multiple different insurance companies, as well as I also do other products outside of just Medicare. I do affordable health care or marketplace policies. I have some colleagues who do life insurance policies as well as Medicare, but the main purpose of this particular page is Medicare products, so that's why I don't focus on anything besides Medicare products. The next topic of conversation is going to be moving. Why it's important to notify your insurance carrier, specifically if you are on a Medicare policy, if you relocate or if you move. And there's going to be a 2-part responsibility for you, the Medicare beneficiary, if you do move. The very first thing you want to do is you want to contact Social Security and update your address with them. Because if your address is different with Social Security and what they have on file with their Medicare products for your A and B to what your carrier has on file, Medicare will cancel you out of your policy after a certain time frame. So it is very important that you call your Social Security representative. You can either use the phone number on the back side of your Medicare ID card, or you can go down to your local Social Security office, call the 1-800 number, whatever you're most comfortable with doing. But if you relocate, and I tell people on the phone, I tell people in person, I don't care if you move down the street, around the corner, across the city, across the state, or across the country. You call Social Security first, and then after you update your address with them, then you need to call your current insurance broker, let them know, or your current insurance company if you don't have a broker and you went through an internal agent, call the customer service number on the back side of your ID card and let them know that you changed your address. Why that's important to let them know that you changed your address. It could affect your policy. Medicare Advantage plans are typically going to be based upon service area, county zip code. So if you move from one state to another state or one county to another county, typically you need to update that contract code. Sometimes that same policy that you are in one county is available in another county. Sometimes that policy isn't available, so you have to find an alternative policy. But it's better to find an alternative policy rather than receive a notification in the mail that says your policy is going to terminate at the end of this month due to your relocating. So, don't put the cart in front of the horse. You need to be able to get this done in order. So call Social Security, then call your Medicare representative, your broker, your agent, customer service number on the backside of your ID card. Very important. Like I said, don't care if you move across the state, across the city. I don't care if you move down the street. You used to live at 8221 whatever road, and now you live at 8222 whatever road. You need to call your representative and update that address. The third question that I commonly get asked here is, hey, my wife, my spouse, my significant other, my husband, they're on policy ABC. They've been on this policy for 5 years. I'm turning 65, in a month or two. I want to get on that same policy with them. I get that phone call quite a bit. And then they're kind of surprised when I ask them, well, let's make sure that policy is a right fit for you. Everybody's health is different. So just assuming that the policy that your spouse or significant other or your roommate, whoever it may be, that they currently have is the right fit for you is the wrong thing to do. As one of the things that I learned in middle school, you never assume anything. So with that being said, if you are turning 65, or if your spouse, friend, neighbor, whoever, is talking to you about a specific policy and says, hey, this policy, works great for me, you should get into this policy, just be sure that you contact that provider or contact your agent rather, and let them know, these are my health needs. I need to see this doctor, I need to take this medication. You know what, I don't need dental and vision, but I could really use transportation. I can't always make it, my car is unreliable, or I can't drive myself, I don't have my license, I have a couple surgeries coming up and I'm going to need help getting back to and from doctor's appointments and rehab. So those health differences play a pivotal role in what policy that is right for you. So just because, once again, whoever is in the household with you, spouse, friend, significant other, roommate, boyfriend, girlfriend, grandpa, grandma, does not matter. Make sure that you get put into the policy that is right specifically for your needs instead of somebody else's needs. The very last question here is, why use an agent instead of doing your enrollment online by yourself? One of the things that I will tell you is it's not easy becoming a Medicare agent. You have to take a bunch of tests online. You have to go to a general public location and take a certified test. You have to go through a bunch of trainings. It's not an easy process. So with that being said, it's also not rocket science. But if it's not something that you do every single day, it can get overwhelming, it can get complicated, and especially if you're just turning 65 and aging into Medicare and you do an application online by yourself, you are responsible for fixing any errors that is on that application. Whereas if you call an internal agent, like when I used to work in telesales, or if you call your broker, which is what I do now, and you talk to them, they will walk you through the steps. They will take care of you every step of the way. They will make sure that, all the T's are crossed, all the I's are dotted. If there are any errors that pop up, they are responsible for fixing those errors, notifying you of any errors that pop up, as well as making sure this is the most common mistake that individuals make when doing an application online, making sure that the election period that you did choose is the correct election period. I cannot tell you how many times a week I would get a phone call from somebody, well, I did an application online, but it said it was denied, or I went to my doctor, policy was supposed to start on the 1st of the month, it's now the 4th of the month, I went to pick up my medications, and my medications aren't covered. Why is that? Well, your policy never started. Why didn't it start? It said that you use an invalid election period. So if you are going to do an application online, still call into an agent. They're going to probably get a little bit upset with you that you called them and talk to them for half hour, whatever it may be that you need to talk to them for. But do your due diligence. Make sure that your application is done correctly. If you do choose to do it by yourself, I always recommend working with a broker, working with an internal agent if you do know what specific company you want to go with, because it's now their responsibility to make sure that that application is completed correctly for you, as well as it doesn't cost you anything. 100% free for you, the recipient, to use a broker, to use a internal agent. Those internal agents are paid by whatever insurance company they work for. Brokers are paid by the insurance companies that you end up enrolling with. So therefore, you're not paying anything specifically to use the information that we have and the knowledge and the history that we have to making sure that there aren't any errors on your applications. The very last thing here is, well, I talked to my friend and they told me that this policy was the best fit for me, or this policy, is a great fit for them. Once again, that falls back to making sure that you check your needs. Make sure that the policy that your friend has, and a lot of times what will end up happening is the policy your friend has, the policy your spouse, significant other, whoever it may be in your service area, that policy will be the best fit for you, but double check it because it's not 100% certainty. Once again, like I gave you before, you may need transportation where somebody else may need dental. Somebody else may have dentures or implants and they're like, I don't need dental, but I need vision. So it's important to figure out what policy is right for you based upon your specific needs that you have. So anytime that you do an application, whether that be by yourself online or what I'd recommend doing always with an agent, whether that be internal, call into a call center or work with a broker, make sure you do the following. Get a list of all your doctors. Make sure all of your doctors are covered. Get a list of your medications. Make sure all of your medications are covered. Make sure that the hospitals that you want to be able to go to are covered. Think about, do I do any traveling? Do I go see, Uncle Sam in California? Do I go see, Aunt Betty in Colorado? Who am I going to see? Am I going to go traveling, once the pandemic is officially over? Am I going to be, being willing to go road tripping? Am I going to go out to Utah? Am I going to go to New York? The big question there is travel. Just make sure if you do travel down the road, that your policy allows you to have that flexibility and coverage. Typically, nationwide emergency coverage is covered under the majority of policies, but if you're going to have extended stays at any of those locations outside of your normal service area, it doesn't hurt to double check when you talk to your agent, or if you do it online, throw in the zip code, throw in the state of wherever you're going to be, double check the facilities in that location just to make sure that those locations are covered by your insurance policy of choice. My name is Travis Dahlman. I'm a licensed Medicare broker. I thank you for watching.